I do believe that if the announcement said all healthcare workers, then all healthcare workers should get it regardless of which ministry they're working under, because they were exposed and remain exposed during this pandemic.
The sentiments of one nurse who works at the Palms Geriatric Hospital. The woman who opted to speak anonymously relayed to Nightly News during a recent telephone interview that over the past 2 years, she has been taking care of COVID-19 positive patients at the Palms, just like the other nurses who work at other regional health institutions. As such, the woman says that she does not understand why only those nurses were catered for by government.
Very hard last year, straight through the pandemic we have worked. We have dealt with COVID cases at the Palms. We have dealt with persons coming across the GPHC as admission to the Palms who had negative COVID tests, but then eventually came down ill. Then when you took them back, you found out that they had COVID still. So we're actively part of the frontline workers.
President Irfaan Ali, in a broadcast message last month, disclosed that $612 million Ghana has been set aside to pay out a 2-week tax-free bonus to all healthcare workers. Upon hearing the announcement, the woman said she was elated since she believed she would have also benefited. But to her disappointment, she did not receive any additional money. Since then, the woman said she has been inquiring from various ministries, including the Ministry of Human Services and Social Security, about the tax-free bonus. However, it has been an unfruitful endeavor.
When we queried this, we queried with our ministry, which is the Ministry of Human Services, we were told, they were having some difficulty and we're going to get it by old years. Old years came and went. We heard nothing back from the ministry.
The woman now wants answers from the government as to why only a specific category of healthcare workers have been paid while the others received nothing. Meanwhile, when the advisor to the Minister of Health, Dr. Leslie Ramsamy, was contacted for a comment, he confirmed that the 2-week bonus was only for healthcare workers whose names were on the Ministry of Health's payroll.
There are people working in a health facility that is not operated by the health sector, not necessarily Ministry of Health, but the health sector, meaning Ministry of Health, GPHC, Regional Health Services, under the 10 regions. If it is not on one of those payrolls, they wouldn't have got.
He then divulged that the Ministry of Human Services will have to make provisions for bonus to be paid to healthcare workers who fall under their purview. However, when Nightly News reached out to the Ministry of Human Services on Monday for a comment on the issue, the ministry's public relations officer, Romario Samru, could not provide any information. For the HDP Nightly News, Kendell Richmond.